So cholera, like Dr. Oguni just said, is a bacterial disease. It's an infection that is caused by a bug, a bacterium, okay? So I use that word, a bug, so everybody can get what we're talking about. And it's a fecal infection, which means it comes from the feces to the mouth. So when people stool, when people are infected and they contaminate water sources and contaminate some food sources with the bacterium, with the bacteria, then it gets into human beings. It gets into human beings and then it releases toxins. These toxins kind of open the tap of the body and then water comes out. So so that's it. It's a bacterial infection. It's taken in through contaminated food or water, and it causes basically stooling and vomiting with severe dehydration. And so the symptoms are very clear. Severe stooling, which is very typical. If it's cholera, it's very typical. We call it rice water stool. So imagine if you boil rice, if you parboil rice, and then that's soggy kind of pale water that comes out. Cholera stools are like that. So they look like rice water, and so it's very typical. And then it causes dehydration, especially in children, and it's something that can kill within minutes, literally within minutes. And so that's it. And like Dr. Guni said, our habits, the things we do in terms of open defecation, in terms of poor sanitation, not washing our hands well, these are the things that preposition the infection to take root and to spread. And then when we even use contaminated water to wash our fruits and vegetables, we can also eat these thinking that we've washed them, but we actually, because we use contaminated water, we get infected. And so this is the simplest way to explain what cholera is about. And there's several serotypes of the Vibrio cholerae, different types. And we have some certain types that cause epidemics or outbreaks like we currently have. And so when those types are out, it's now left for everyone in the community to realize that there's a problem and link with the health system, link from the communities to the health system, to epidemiologists, and to public health officials, to ensure that we're working together as a team to prevent this infection. So that would be a brief overview of what's happening in the cholera ecosystem.
Who are those more susceptible? Would you say children or adults?
So everyone is susceptible, but children would suffer more severe consequences because they lose 70% of their body fluid is gone, and then they die more easily. So everyone is susceptible, but children are also extremely susceptible, and especially those who live in areas of poor sanitation, people who have very poor access to water and sanitation services, no toilets, no hand washing facilities, no clean drinking water. These are people that are susceptible to cholera.